Please, somebody, the chair will entertain a motion to approve the March 10th, 2022 minutes as presented.
Approved, Bob.
Thank you. Melody, is there a second?
I second. This is Sherilyn.
All right, Sherilyn, thank you. Is there any discussion? Hearing none, let's take a voice vote on the approval of the minutes as presented. Leilani,
Approve.
Christina,
Aye.
Erin,
Approve.
thank you. Iolani,
Aye.
Linda, Keith.
Aye.
I vote aye. Why, Ollie,
Aye.
Erin,
Aye.
Murray,
Aye.
Melody.
Aye.
Minutes for the March 10th, 2022 meeting have been approved as presented. The second set of minutes we need to approve are those for the special meeting executive session on March 24th. We need a motion to approve those minutes.
I'll make the motion to approve. Sherilyn.
Is there a second?
This is Ben. I'll second.
Since there were no indication of any changes or revisions, we will move to the vote. Lonnie,
Aye.
Justina,
Aye.
Erin,
Aye.
Lenny,
Aye.
Dan,
Aye.
I vote aye. Ollie, aye.
Aye.
Sherilyn,
Aye.
Murray,
Aye.
Melody.
Aye.
Executive session minutes have been approved for the special meeting on March 24th, 2022. Thank you. The floor is now open for public comment. A reminder that public comments are limited to 2 minutes per speaker and must be related to agenda items. Are there any public comments to be shared? Evan, do you have anything else? There's nothing in the chat, right? I'm assuming that there are no public comments to be made at this point in the meeting. There will be another opportunity toward the end of the meeting if public members wish to offer thoughts for the board to consider. Item number 4 on the agenda is the updates from the Executive Office of Early Learning. I'll turn it over to Colleen to lead us through that portion.
Good afternoon, everyone. Can you hear me okay? Okay, thanks. Today, Jordanis will be giving us the legislative updates, and then I'm asking if Kyoto can join us with the Department of Health to update us on vaccine.
Hi, everyone. Can everyone hear me okay? Can you hear me?
Thumbs up if you can hear Jordana.
Okay. Okay, so I'll go through some of the bills that are still moving through the ledge session. HB number 2000, this is the bill that appropriates funds to the School Facilities Authority for construction of preschool facilities. That had a public hearing or a decision making on the 7th of this month, and it will be going to conference. SB number 2819 and 2820, which relates to teacher compensation, was also heard and its passage was recommended. Both of those bills will also be going to conference. SB number 2701, the subsidy pilot program bill, and the bill that also includes appropriations to the Early Learning Special Fund for the purpose of the Early Childhood Educator Stipend Program. We'll also be going to conference SB number 2700, which requires staff of licensed and registered early childhood programs to provide information to the DHS, so the registry bill. We'll also be going to conference SB number 3110, which renames the preschool grant program to the childcare grant program and authorizes the special funds to be used to give grants to childcare facilities. We'll also be going to conference SB number 2634, which extends Medicaid postpartum coverage. We'll be going to conference. SB number 2482, which would establish the temporary Office of Wellness and Resilience. We'll also be going to conference. And then HB number 1600, the budget bill, will also be going to conference. One thing to note for the decision-making in the Senate Ways and Means, they did announce that $2 million were appropriated for early learning programs. We still have to take a look at the budget bill to see where specifically the funds have gone. But again, the budget bill will be going to conference, so the House and the Senate will have to be negotiating provisions in the budget. For the resolutions, they are all still moving. The HRs and the SRs on this list have all been adopted in its final form, so they have all passed. So SCR 53 and HCR 69 designating September as Child Care Provider Appreciation Month. SCR 53 had a hearing this morning and passed. SCR 217, which is the developing a roadmap for Act 46, urging ELB to do so, has a hearing today at 2 p.m. with the House Committee on Education. SCR 13, which is the Universal Pre-K Feasibility Study, also has a hearing today at 2 p.m. with the House Committee on Education. And SCR 34, which is the board composition resolution, also has a hearing today at 2 p.m. And then just a few legislative deadlines to note. Today is second crossover. It's also the last day for the originating body, so the body that introduced a bill, to disagree with bill amendments. April 19th is second lateral for Senate concurrent resolutions, and then April 25th is second crossover for concurrent resolutions. Next week is also conference, where the two chambers will be negotiating bills that the originating chamber disagreed with. And then April 28th is final decking of non-fiscal bills. 29th is final decking of fiscal bills. And then May 5th is CAB, the end of the legislature session. Another thing to note, so Colleen and Kathy Betts and Dana Luca did a presentation to the House, the Committee House on Education. So it was a House Legislative Informational Briefing on April 5th. And they discussed efforts underway regarding COVID-19 mitigation efforts and early learning expansion plans. We do continue to work with other departments and stakeholders to coordinate testimony. And we've begun attending hearings in person at the Capitol since it is now open to the public. Any questions?
Anyone have questions for Dana? I do have one, and I don't know if you have the answer to this, but I find it interesting, and maybe this isn't a question, just a comment. I find it interesting on the feasibility study resolution that the agency being charged to undertake the feasibility study has provided testimony that it does not feel qualified to do so. And yet there has been no change in the legislation. Do you have any insights about what caused that or why that is the case?
No, I'm not sure why the Legislative Reference Bureau was tasked with it. They were pretty clear in their testimony that they didn't feel they were the appropriate entity. So should the resolution pass, it would be up to LRB to essentially determine if they're going to be urged to conduct that study.
Right, it will be interesting to see how that does turn out, simply because of the organization feeling unqualified, and yet being charged to take this on. There was also a great deal of testimony, for those of you who have not seen the testimony, about things that needed to be considered, including past studies that had been done, and consideration of plans that are already happening, and needs that the state has around issues like workforce and facility capacity that not be overlooked. There has been no substantive change anyway in resolution language as it exists today. So I'm curious to see how that ends up after the education committee. That's the only question I have. Anyone else have anything they want to ask Jordana about the legislative bills that are moving forward or the resolutions? I'll share a little bit in my update about the other two resolutions as well later on. All right, Colleen, continue.
Kyopu?
I'm sorry, I forgot that I don't need to turn on my mic. My apologies. for this. I'll turn it over to Kyopu.
Aloha. We just wanted to give a quick update. So if the board will remember, last fall, EOEL took on the task of trying to develop some materials, essentially PSAs, to encourage vaccinations. And the goal of that was just to really center the conversation around how vaccinations for everyone impact the early childhood community, and particularly young children. That was kind of the start, the entry point of EOEL's involvement in encouraging vaccines and working alongside DOH. Since then, as many of you probably have been tracking, we've seen kind of fits and starts as to whether or not there will be a vaccination grant and emergency use authorization for children ages 6 months to 5 years, up to 5 years. And depending on which announcement it was, it would depend on, and which vaccine it was, depend on what the age group for that was. But as we did that, and over time, we worked alongside our DOH partners and stayed in touch with folks in DOH to make sure that we were getting some of the voices of early childhood involved, as well as to make sure that they were supported, so that when they do the rollout, they're able to make sure it's as effective as possible, so that our community can be best served. So as far as the PSAs go, I know as of February, they were still airing on some news stations as PSAs, which was wonderful. And we've gotten a lot of good feedback. And then since that time, we have been working with folks, DOH and their team, to get information specifically about what that vaccine rollout would look like. So before I hand it over, I want to hand it over to one of the amazing folks that has been just really great to work with, as far as ensuring that the early childhood community is involved, as well as helping to inform for effective rollout whenever we do get that emergency use authorization. I'm going to hand it over to John in a second, but before we do that, I want to give a special thanks to the folks who helped us get some survey results. We were able to get, in the span of, I believe it was 2 weeks, thanks to the help of HAIS, DHS, private childcare providers. I believe DOE also assisted, HCAN and charters to some extent, helped get a survey out, and we got more than 1,000 survey responses, which can help to get some, and that was just in the 2-week time frame. Help to get some really important information for the team to roll out. So I just want to, before I hand it over to John, I want to give a special thanks to all the partners in the community who helped us get a really good survey turnout for a very, very, very tight time frame. So with that, I'm going to turn it over to you, John, if you're ready, to present a little bit more information about the vaccine rollout.
All right, thank you, Kyopu. Can everybody see the slides? Perfect. So appreciate the opportunity to brief today. My name is John Shear. I have been supporting the Department of Health since September 2020, over coordinating the overall COVID-19 vaccination program rollout. We really appreciate the support of stakeholders especially what's happened with the Executive Office on Early Learning, as we just or kind of get an overview of. And it really has led to the state of Hawaii leading the country when it comes to vaccination efforts. So in some cases, we've been #1 in the country for vaccinations, and others were, top 10 when it comes to just the rollout. And it's through the support of stakeholders like we've had today. So what I'll be covering briefly is just a quick update on the 5 to 11 vaccination effort. We think that helps to provide some context about what might be dramatically different about the rollout for the under 5 campaign. So I want to make sure everybody kind of understands what we did for 5 to 11 and how that's going to be different for what's going to happen for this age group. We'll talk specifically about what we're doing to support the under 5 or U5 vaccination campaign. And then we'll get into just a little bit of update on what some national preparedness guidance is that came out last month to talk specifically about the education sector and what can be done kind of for COVID-19 writ large, not just for the vaccination efforts, as well as kind of next steps and what we're looking to help get some help from stakeholders on. So when it comes to the 5 to 11 vaccination efforts and what's happened throughout the state, it kind of ties into what I was mentioning before, where we've got 77.1% of the entire population is fully vaccinated. You can see what the breakdown is on the right side of the slide, and you can obviously see the younger age groups are kind of lagging when it comes to initiating and completing those doses. The darker green is the booster doses that they're just not eligible for yet, and you can see what the progress looks like over time. So the intent is to continue to focus on getting the unvaccinated vaccinated. And that's the next age group we're getting into, where there's about 75,000 children in that 6-month to 4-year-old age range. And we're trying to see if we can convince parents and guardians, once the vaccines have been approved, to be the first in line to get their children vaccinated. The estimates throughout the country range about what that might look like. Typically, for what happened for the 5 to 11, there's about 30% of parents that were right away. They had the children lined up as soon as the day happened. In early November, they were ready to get their children vaccinated. We don't think it's going to be that high as 30%. It might be a little bit less than that, but the intent is to be ready for them once that decision is made and they are interested in getting their children vaccinated. What the nationwide efforts look like has been for the 5 to 11 campaign was about almost 35% of children have received at least 1 dose in that age range. 28% have completed. In the state of Hawaii, it's been 42.3% have actually initiated and 38.2% have completed. So much higher rates than the rest of the country. Over 96,000 doses have been administered throughout that program. What that looked like over time was we leveraged heavily the use of schools and school-based clinics. And so there was 379 school-based clinics that took place. We do have a handful that are scheduled for April, and you can see what that looked like over time when the first clinics took place and also what that looked like by county. Kauai handled things a little bit differently, where they directed the children to go directly to vaccination providers, whereas the rest of the counties was a much proactive effort to get the DOE schools, DOE charter schools, and the Hawaii Association Independent Schools involved in supporting clinics at their locations. So you can see they opened some of those locations up, not just to children, but the total doses meant they might have parents or staff members or other family members that got vaccinated at the same time. And then the 5 to 11 were the actual just for the pediatric doses that took place. For the under 5, it's going to be a different formulation than the 5 to 11 or the next age range. So it is a very targeted vaccine that they can't just go to any location. It's got to be a provider that offers the under 5 vaccine once it gets approved. So these can be very complex when you're trying to do multiple types of vaccine. So if it's Pfizer that's approved, some of the providers will have Moderna at the same location. They'll have different age groups that they're offering. So the intent is to try to make it as easy as possible for parents and guardians to know where they can take their children. So for the under 5 campaign, there is some guidance that came out from the federal government that talked about getting ready to launch that effort. We originally thought that the approval would come in February, and it just hasn't happened yet. The best our crystal ball can tell us is it's probably going to be closer to the May timeframe, which I know is only a couple weeks away. It might be mid-May, it might be end of May, it might be early May. We just don't know. So once the data comes in, we'll be able to identify what the next steps are going to be. We know that there has been some submissions from Moderna and Pfizer for the different age groups to try to get those approvals to happen. And at that point, we'll understand whether it's a 3-dose regimen, what the actual formulary is going to be, and then be able to provide that guidance so to be able to communicate what that looks like in terms of safety and efficacy of that vaccine. When it comes to what we've been doing to prepare, the intent is to make sure that we've got providers lined up. A number of the mass vaccination sites, as I'm sure everybody's aware, is shut down. So the Blaisdell site, Pier 2, those other locations are not going to be supporting the Under 5 campaign. Most of the mobile events are not going to be supporting that efforts. And so there's a targeted kind of effort to try to increase the providers that are out there at the pediatric level so that pediatricians are able to, or family practitioners are able to administer vaccines in our offices. And the idea is that we want to make sure those locations for potential days and hours of operation are clear to everybody, because pharmacies are not going to be able to vaccinate children under the age of 3 years old. And some of the pharmacies, as I'm sure you might have heard, have been closing down. So Foodland Pharmacy is closing. That was one of our vaccination providers. Other like Longs or Walgreens might only have 3 or 4 stores that are going to be offering the Under 5 vaccine. So it's going to be really incumbent upon stakeholders to get information out as quickly as possible for where children can get vaccinated, because it's just not going to be as accessible and available as it was through previous campaigns. So what we have been doing is reaching out through the survey that Kyopo mentioned. The idea was to try to figure out, what are, what's the interest in parents and guardians in general? What are their preferences for locations? What does that look like in terms of resources that we can provide to them, in terms of where they get their information? If they have any suggestions that can help us to guide efforts, and then obviously making sure we understand preferred days and hours to help tell the vaccination providers what they need to do to be ready. And as we mentioned, there's been over 1,200 responses to date. The survey is still open. We are still collecting information as it comes in, but I think that gives us a good snapshot, and just share that with you briefly. So basically, the ask was, do you intend to vaccinate your children? And 45% were saying yes. It's obviously a skewed poll, because people that are taking the time and effort to respond to a poll like this are probably a little more likely to be able to say that they're going to do that. You can kind of see what that looks like. Where would they prefer to get their children vaccinated? So overwhelmingly pediatricians' offices. And then we also asked about things like a mobile clinic, if that's something that might be of interest. So we have providers like Healthy Mother, Healthy Babies that have said, hey, we'll go out, we'll provide support. Other providers are willing to do some mobile efforts. But like I said, for this, it's such a diverse population that services that. That's one of the things we want to really try to get as many of the offices signed up as possible. When would you prefer? We were assuming that most of the parents would want to do it over the weekend, and the majority was actually no preference. And so they're just saying, hey, let us know when it's available. Same type of thing of what time of day. We were assuming it was going to be after work hours or something like that. And really majority was no preference. And then I did want to share, there's a lot of trusted resources out there. We would recommend having these discussions now and talk story sessions and getting information out so people understand what that looks like, especially the multilingual resources that have already been developed, and then the social media sharing information. Just realize that information really can't be pushed out until they get the safety and efficacy data, and then we can amplify those messages, and that's what we're waiting on. So the final thing was just the guidance from the National Preparedness Plan. The idea is that this was released in March 2nd. It talks about what we can do to help be better prepared for COVID-19. The education sector guidance that came out just talks specifically about things that can be done to make sure there's clean air in buildings, make sure that there's incentives to get employers to offer and encourage sick leave so people aren't coming in sick, updating guidance about ensuring safe workplaces, and then engaging those early education childcare providers to make sure that they are continue to be prepared. So I would recommend taking a look at it if you haven't already. It does provide some guidance about what we can be doing. In terms of next steps, please help to publish information about hawaiicovid19.com. That's intended to be the one-stop shop for that information. Share the information as it comes out from the vaccine, and then trying to encourage people to ask questions now to be able to get those addressed, not just for COVID-19 vaccine, but other types of vaccinations that people might be concerned about. So reinforcing the messaging, and then obviously leveraging the toolkits that exist. And that's all I had for you. Thank you.
We have a question from Lenny.
I had a question. When you were talking about, I'm a center-based provider. When you were talking about places for vaccines, I know that there were opportunities for older kids to get the vaccine in the school setting.
Right.
And we've had some success with having tests in the school setting, but I was wondering if there's any opportunity that, I know it's problematic because of the age of the children, but if there's any agencies that are able or willing to do that.
Yeah, so if there are organizations that are interested in potentially hosting an event for children, they just need to contact us. We have a survey that gets filled out that just says, here's the time, potential dates, the locations, whether there's additional resources that might be needed. Sometimes there might be translation support that's required, other types of things. And if we can try to make that happen, we'll try to work with providers to provide that support. But really, it is going to be, we've reached out to DOE, we talked about whether they're going to host school-based clinics, and at this point, at this time, there's no scheduled school-based clinics that are going to take place. It's all kind of up to that grassroots effort to say, hey, we'd like to set up this location. We think we can get enough families to make this worthwhile, and then we can work to make that happen.
My question was specifically not DOE, so.
Okay,
it'd
same
be
thing.
more-
Yeah.
It would just be more challenging because you have to go through multiple sources, but I was wondering if there was any effort to reach out to the providers to see if they wanted to support that, or whether it's going to be a case by case for the different centers.
Keopa, you want to kind of handle some of the things we talked about when we came to that?
Sure. So one of the things that's been a very, I think, productive conversation with the team has just been having everyone recognize how decentralized the system is and how many different folks are kind of providing care. So understanding that there's center-based, there's home-based, there's friends and family that provide care, even within the licensed and regulated types of care. We have, there's classrooms on DOE campuses, there's classrooms on charter campuses. So just recognizing that, I think ideally what would happen, at least from EOEL's perspective, is that we would be able to coordinate some information going out to providers and leverage partnerships. So I will say that on some of the calls, whenever possible, we do have the DHS Public Information Officer on our calls, as well as keeping apprised the Child Care Programs Office, Dana Luca. So DHS has been involved in a lot of where they're able to have the capacity. So that's why we were able to get the survey out to private providers. And I think we're hoping to continue that kind of model of getting information out and helping to arrange and coordinate the efforts, knowing that, quite frankly, our community knows our community the best. And the team with DOH has been super, just super period, as far as just recognizing the unique needs of the system. And that if we can work together, we can get that coordinated effort. So it's not really answering your question, Lonnie, but it is at least hopefully giving you some insight into just recognizing part of it's just the recognition of how decentralized the system is. And then also just starting to tap folks so that we can start to get folks in line. So I have actually had conversations in addition to the folks who I mentioned were able to get the survey out. I did have a couple other conversations with community members, including folks working with family childcare, like Marianne with Learning to Grow, and Carol with Patch, as well as I spoke with Dawn at PACT, Parents and Children Together. So we've just been trying to outreach so folks are just ready, right? So it's part of that. We're right in the Makakao phase. And so just everyone's ready to roll out. But I think that's what we're looking for ideally from a systems coordination, is just recognizing we're going to need all hands on deck and starting to get those folks in line now. So I can't promise it's going to be as smooth as it was with the 5 to 11s, given that we do have a centralized DOE system for that age group. But we're going to try our best.
Well, Ben has a question.
Yeah, just a quick follow-up question around the hosting those events. Is there like a minimum amount of kids that you guys hope to get vaccinated through one of these hosted events, like 50 or whatnot? It'd be kind of interesting to hear what capacity, like minimal capacity, because you hate to set something up and only you can bring 20 kids. So just wondering.
No, it's a great question. So when we first started, all the providers we need 50, otherwise we can't make it happen. And they're like, hey, we'll take 10, that type of thing. So I think it's just the minimum dose file. Typically, I'm assuming it's going to be 10 doses per vial. And so that's what they try to target, is trying to make sure you got 10 kids lined up. If they only have 2 kids, they're still going to use it. But, you know, especially that initial phase, typically what's going to happen is that the vaccine gets approved, we'll be able to pre-position the vaccine here. And then there's going to be that demand that we want to be able to support. And there might be a limited quantity that's be able to go out around the country. And so that's what we want to make sure is we've got, trying to minimize wastage. And so it makes sense if you say there's going to be 20 and only 10 show up, they're going to support that. But if you just, the intent is to just communicate early and often, because that way they know how much staff to bring. But they've serviced as little as, like I said, 10 or 20 with as long as they're able to get those lined up. It's different than what we did previously. Like I said, there's 75,000 kids that were in that age group, you know, 30% or so that might be ready to go initially. So we want to make sure that there's 20,000 some opportunities for vaccinations, and they just can't go to Walgreens or Longs like they did before. And so that's what we just need to make sure they're having these discussions with their pediatricians now, and they're talking about whether they can support that. And if their pediatrician isn't offering, they should be asking, hey, are you referring to somebody else? Or what's that expectation? Capilani is probably going to open some specific center opportunities maybe on Saturdays for like 4 weeks in a row, but we're not going to know that until we get more details on, you know, what when the approval comes in. Okay.
Are there any more questions? Anyone else have any questions or any comments they wish to offer? If not, Kyoko and John, I want to thank you both for sharing the results. I think we're all eager to see this continue, obviously. And I think this is a great example of ELEL working in a system that is broader than just the educational piece, even though there's a lot of educational work being done. And so we would hope to see these kinds of partnerships that Kyoko has arranged continue in the future, because it is part of the system within which, your statement was a really good one, there are a lot of other systems. It's not just one system, and that's what makes it really so challenging to coordinate. Thank you both for sharing with us today and for the work you've been doing. We appreciate how important it is. Right. Anything else that you wish to add after updates? Right. We all received the written updates from the Executive Office on early learning. There was other information included besides the 2 reports we've just received from Jordana and Kyoko. If any of you have questions about other information included in the report, please ask them now. Indicate in the chat that you'd like to ask a question or make a comment. I can't really see any, but I'm too far away, so you can tell me that they're right now.
Oh, why Ali has a question.
Okay, why, Ali, you have one?
I do, thank you. I had a question particularly about the public pre-kindergarten program enrollment. I'm curious if we have an understanding around applications approved and then total enrollment at the end of Q3. It's such a big gap. And if there's more information as to why the numbers are so different.
So part of it is because of the where those applications come in, what schools they're from. Certain schools will have more applications come in, and then there are other places where there are not. Some of it's because of the applications are denied. They are priority categories, and because we can't take.
Oh,
Sorry,
speak up,
I'm
please.
sorry. I was told you can't wear masks.
We're gonna say the windows are open, the air is on.
Yeah, just
Okay, I'll just try to talk a little louder, sorry. So it has to do with where the applications are coming in from, which particular schools. Some schools have more applicants than others. And then it has to also do with the number of children we can take in those, because of COVID. And some of it also has to do with sort of the timing of things. Applications may have come in, they were denied, and they may have been approved. They could have been approved now with the new guidelines that probably came out in January for the FPG, but those people have already found places. So there's a combination. I don't have the breakdown with me, and I can find out more if that helps, but I don't have the specific breakdown with me. And as I saw that little question about is the COVID restriction still affecting enrollment, and it is because because the masking is still a requirement within the Department of Education for indoors. We follow that as well, which would mean that the children who are there in the classrooms need to have that 6 feet distance when they are without their masks for those rest times and the times that they may be eating in the classrooms. And so we are not at, none of our classrooms can go up to 20 in the way that we go.
Thank you. So, sorry, a follow-up question. So the 405 maximum enrollment is reflective of COVID numbers?
Yes.
COVID restrictions?
Yes, yeah, and that, and has to do too with the class size, this physical space, because some classrooms are bigger than others. So some classrooms can take more kids without masks than other classrooms.
Dana, do we have any sense that any of that is going to change as we hit fall at this point about distance requirements and masking for young children? Maybe too soon, I don't know.
Yeah.
I do think physical distancing is not one of the core mitigation strategies anymore for the DOE. So
It's not for the, I'm sorry, can I speak?
Yeah,
now? Sorry.
yeah.
It's not for the DOE, but for, because we also follow DHS guidelines, and because when children were without masks, they should be kept apart with the 6 feet. That's always been what we've had to follow for the DHS guidelines that cover the younger children. So when they're without masks, they need to be 6 feet apart.
so that's a DOH requirement, not a DOE requirement.
DHS. So part of what we, so EOEL, the public pre-K also has to abide by the DHS requirements related to basic health and safety for young children.
Okay, so can you hear me?
Yeah, if you speak loud enough, then
Oh, okay. Okay, so we are working on updates to the guidelines. It is still based on, going to be primarily based on DOH's strong recommendations to continue masking indoors, but it will be strong recommendations. And then we're planning on making some other updates to the guidelines, and hopefully we will have it out by early next week. But again, we're kind of shifting, but in alignment with DOH's strong recommendations.
Thank you.
Excuse me, I do have one
Oh, sure. Go ahead.
conversation. Sorry. This says totally, it has to do with the public pre-K, but I just wanted to share that there was a typo in the updates that we sent out regarding the expansion of public pre-K, and I can go over it again when we do the presentation, but
Okay.
for the schools that are applying, and this is for the new biennium, that when they, depending on how many classrooms are funded, the classrooms that will go through the induction program, the update stated that the induction program was taking place in 22-23, the school year 22-23. That's a mistake. The induction program takes place in the 23-24 school year, and then classrooms open in 24-25. So that's just a correction that.
Thank you. Are there any other questions that come in before we close out this portion of the meeting? All right, hearing none, we'll move to item 5 on the meeting, which is the subcommittee reports. The first portion of that is a report from the systems mapping subcommittee, an update today. Lonnie and Ben, I understand that you were going to provide that report for us.
Yeah, well, I have a short, just one slide, if you could show me, let me screen share. All right, this is a brief update. We, as the mapping committee has been meeting. The hard part is that we're trying to pull different partners together. So as of yesterday, Ben, feel free to jump in. AUW, 2-in-1, Kiki Central, Center on the Family, and Patch Platforms and Maps are all now working together with both a timeline and the goal is to have them somehow interwoven so that they can either refer to each other or have strong alignments. We would also like to connect with DHS about the DHS website so that we can also look at their consumer education when it comes out. We have a budget, it's created, but it's going to require partner input, which we haven't gotten to that step. So it's at the bottom of this document and I'll show you, but it's very drafty at this point. We do need to modify our timeline. There was some staffing changes at Kiki Central, which did interfere with our ability to move out, but we have resolved it and are moving on. We're looking at, we have some soft offers for funding to help us roll it out, but we're looking for doing a 2-year funding. And the goal would be to work on fundraising and creating that budget more solidly, but working in July and still having a launch in the end of the year or the beginning of 2023. Carol Ware has been very involved, so Patch is looking at a commiserate timeline. There will need to be an ask to looking for the next biennium budget, which I know is coming pretty quickly. So we are meeting regularly in order to be responsive. Maybe there's some way that we can look at sustainability, whether it's through the state departments and then some type of matching funds if possible. So this is the rough draft of the budget. So having a coordinator, and that would be a contract for services. There would be a first year higher cost on map designing and then an ongoing cost for maintaining the maps. If we go through AUW, there is a subscription cost annually. And then the marketing and outreach would be part of the coordinating, but we're looking at it as a separate cost. We have not yet costed out how to maintain the Center on the Family Map project as part of this. You can ask me questions. I may or may not be able to answer them, but I can at least note them for the committee.
Just to confirm, this is a draft, Lonnie?
Absolutely. I actually wasn't sure whether I should put it up, but I know people might want to see that we're thinking about it.
And when you come back and it's moved beyond the draft for consideration.
Correct. And we should at that point have partner buy-in and a process for looking for funds.
Does partner buy-in mean contributing to the funding as well?
Yes.
So you don't have any idea what the ask might be at this point?
Nope. Nope.
So we shall put that on hold until the.
Not hold, slow moving, but yes, it is moving. I have no ask today.
Anyone else have any questions for Lonnie or Ben?
Thank you.
Okay, thank you for your report. Ben, do you want to add anything or? We okay?
Lonnie was tasked with giving the update, which was good because I missed the meeting yesterday. So thanks, Lonnie.
Thank you both for sharing with us where your thinking is. We will look forward to receiving a report with a budget more defined in the not too distant future, but knowing that some work has to be done before that will be ready. The other subcommittee report is the Director Search Subcommittee on the Status Report. Steve is not here today. Kim, I think he was asking me to do this report, this update, is that correct?
Yes, that is correct. I do not have information regarding the search committee. Thank you, Bob.
Thank you. I just wanted to be sure that I wasn't stepping on toes. I realize that everyone is pretty much aware where things are at the moment, but want to make it official. The Director Search Committee has successfully completed its selection of Yuko Arakawa Cross, currently the principal of Daniel K. Inouye Elementary School, to serve as the Director of the Executive Office on Early Learning. May 2nd will be her start date in the position, and she will be introduced at our May 12th meeting officially. I want to be sure to thank the search committee for its many, many hours of work during both phases of this process. I want to thank Matt and Steve Schatz for serving as chairs. Extend my appreciation to the advisory group for its helpful input, to Incan Search Firm for continuing to work with us, even though the first search portion was unsuccessful, and guiding us throughout, and especially to the ELEL staff for your patience and continuing the work of the office as this process moved forward, albeit a bit more slowly than anticipated. Colleen, we want to thank you for stepping up and giving the stability the office and staff needed during an incredibly challenging transition period, not only without a permanent director and wondering who it might be, but also added to all of that with the COVID challenges. We really have appreciated your work. You've kept the system building moving forward, and we appreciate that. And we do appreciate the continued work of the staff in particular, who did not let down in any way, but continued their efforts throughout this time period. Much appreciation to everybody who participated in this effort. All right. We'll move then to item number 6. There are no other subcommittee reports at this point ready to be shared with the board. Item number 6 is actually an expansion, if you will, of some information that Carol shared with the board at the May 10th and the March 10th meeting. I asked Colleen and Dana if they would come and share the update that they did with a briefing at the House Education Legislative Briefing Session a week ago, because it looks at the interplay of DHS and ELEL, and even though some of the information will be familiar to us because of what Carol shared, seeing it within its larger context, and it actually is more amplified now than it was at the time that Carol was ready to share with us, I think will give you a better idea of how the two agencies have been looking at the expansion that goes out of Act 46 and 210. Also the challenges that they've confronted in trying to get to the point where they could focus energies on this expansion process with some of their planning for the future. So I'm going to turn it over to Colleen and Dana to share with us the presentation that they shared with the legislature last week.
Dana will share the slide deck. So a little bit of context before we get started. So this is related to expansion and specifically around Act 46 and Act 210. So I think I'm sure I can speak on behalf of Dana too. Although the conversation discussion is around the expansion of the 3s and 4s, we are really clear that this is not to take away from the work that has to be done for prenatals and 3. Just want to set that context. So we did start by explaining the two entities, and that EOEL is statutorily charged to work across public and private sectors and with our state and community partners to develop an early childhood system that is both comprehensive and integrated. We work towards this vision and fulfill our statutory responsibilities through collaboration and partnerships as we work on behalf of children, families, and the early childhood sector workforce. We administer the EOEL Public Pre-Kindergarten Program, and we support investments, policies, and programs that strengthen the private early learning sector.
So DHS, these are our guiding principles under Article 10, Section 3, is to provide assistance to persons in need. And we just want to point out that it's persons and not citizens, because we do provide state benefits regardless of citizenship. One foundational underpinning is entrench the Aloha spirit in the work that the department does to ensure individuals and families are treated with respect and dignity. The department administers its programs through an integrated multi-generational approach to reduce intergenerational poverty. And we do this through our Ohana Nui concept. The Ohana Nui concept is enshrined in statute, and it requires a shift in mindset from, like, we have to look for ways to say yes rather than ways to say no. And it's against this backdrop that we were able to shift as a department during a public health crisis that highlighted the deep inequities throughout our state and that impacted the childcare community so greatly. So the childcare programs in DHS, we have the licensing program, which focuses on the health and safety requirements, quality initiatives, subsidy programs, the childcare connection program, preschool indoors program, and childcare quality initiatives, such as training and scholarships for childcare providers, accreditation support for family childcare providers, statewide CCR&R services, early childhood registry, and higher subsidy rates for nationally accredited centers and homes. So the COVID-19 impacts on childcare, it really emphasized how critical childcare is. And it's a critical role. So our efforts focused on stabilizing the childcare community. There were many temporary and permanent closures of childcare facilities and homes, and of course, we saw a big reduction in the childcare workforce. So the last 2 years have exacerbated the issues impacting our childcare providers, as well as the difficulty for parents and families across the state struggling with childcare. Over the last 2 years, DHS has become focused on stopgap measures to ensure critical needs are met in a timely manner. We have to quickly apply for and implement federal and state waivers and to appropriate and expend millions of dollars in federal funds to help keep childcare providers open. The department endured many retirements, went through a hiring freeze, and a significant cut in state funds and positions. So just want to point out how critical that it was that our staff was working at its capacity for the last 2.5 years. This shows a decrease of regulated childcare providers across the different types. Pretty huge decreases from state fiscal year 2020 to February 2022. Overall 16% decrease. And then along with the decrease came with an increased demand for childcare from July 2019 to January 2022. So some of the efforts that we did to sustain the childcare sector, Pre-pandemic, we spent almost 10 million in state fiscal year 2020 to provide low-income families who are working or participating in education and training activities to help pay for childcare. And then to present pandemic, we've expended almost 31.7 million in state fiscal year 2022. And we suspended certain eligibility requirements. For example, we disregarded income limits for those that were affected by the pandemic. We implemented temporary increase in childcare rates. We allowed for a second provider payment. And then we had to adopt emergency rules which promoted more access to quality care. We also waived income eligibility requirements for families impacted by the pandemic. So like the essential worker families. And we waived the activity requirement for parents or families that were impacted by the pandemic. And we also waived DHS family co-payments. We provided the maximum subsidy benefits for families impacted by the pandemic. So we also, these are we increased maximum childcare payment rates across different types of care. For POD, preschool indoors, we extended the application period for an additional 1.5 months. Applicants were able to modify their financial information, which could have led to increases in their subsidy amounts. We're able to, POD families are able to continue and receive subsidies to hold their child's seat for the state fiscal year 2020, even during stay-at-home orders. We temporarily increased the POD rates up to 1,500 for accredited preschools and up to 1,200 for non-accredited preschools. And we allowed POD families more time to find a preschool for the state fiscal year. So with all those expanded eligibility changes, you can see this is a graph from the childcare connection point on the left side for federal fiscal years 19, 20, and 21. You can see that huge increase on the childcare connection subsidies. And then on the right side is the preschool indoors, which, you know, with the reduced funding, you see the decrease. So how we adjusted to the preschool indoors decrease was families that were eligible, they had a work activity, we pushed them over to the Childcare Connection Hawaii Family Childcare Connection program, so that more POD families could be served through that program. And then of course, our wonderful access to resources for childcare providers through federal funding sources. Like the CARES Act, we were able to establish 171 contracts and awarded 2 million with childcare providers. And then additional CARES funding, we were able to partner with White Community Foundation that implemented 11.3 million in grants to 150 providers statewide. And then this is just showing additional appropriations for federal fiscal year 21 through fiscal year 24. Just want to point out that to date for the ARPA Child Care Stabilization Grant Program, we have 38.1 million approved with a few applications pending. And then, of course, these are some of the COVID-19 challenges when trying to implement the vision of Act 46. So, of course, no appropriation was made to expand the POD program to serve 3-year-olds. continue to work on our technology data system modifications. We continue to work on administrative rule changes. And then we had a reduction in our IT positions during the last 2 legislative sessions. We continue to work on data sharing requirements and benchmarks with EOEL, DOE, and the Charter School Commission. Few other challenges that we encountered was our childcare connection rate contractor experienced a lot of staff turnover. It was really hard to retain and recruit staff to that program. In addition to that, we had a reduction of AIF funds and a reduction of nearly 400 positions. We are working on our capacity to implement multiple initiatives. We continue to work on being in compliance with our waivers to our state plan. We've implemented that DHS emergency childcare services contracts, the contracts with HCF for the additional funding. And we're currently working on the ARPA stabilization childcare grant. And then trying to navigate the increase in subsidies from 2019 to present, which is about a 209% increase. But with all of that, we have a great partner with EOEL, and we are moving forward with work on Act 46.
Dana. So we have 4 big arenas of work in terms of just the way we're thinking about what we're doing. This is in addition to facilities, which we know is the key component of what needs to be addressed as well. But there are things besides facilities, and that includes these 4 areas as we're organizing in the ground. Is that we need to be mindful of the arena within the current program expansion and whatever programs are currently existing and maintenance, because we do not want to supplant programs. We're also looking at more of that interagency federated data system to enable effective collection and use of child data and use of program data and effective production and use of research. We're also looking at the arena of workforce, which is a knowledgeable and supported workforce that is intertwined with the system of program support for continuous quality improvement. And we're also looking at the ongoing community engagement of stakeholders as we keep expanding and learning more about how to involve their voices in this effort. In Hawaii, the work on behalf of children and families, being that it is embedded within different entities that rely on partnerships in order to grow and strengthen our system, it is essential that we collectively recognize and address the issues and barriers related to expansion, pulling on our assets and strengths as we carve out our plans related to Act 46. So as we move forward in our planning and execution, we also want to mention that we do want to be mindful of the solid grounding in our early childhood state plan, as well as a corresponding implementation plans. And we recognize that our collective engagement in this work and anything that comes out of it should not only be aligned, but to be derived from the great work and very thoughtful work already done by the folks in the community as we continue to build on what existing plans we do have. So one aspect of EOL's responsibility, at least for the public pre-K side of things, is the expansion of the pre-K program. I think some of this was shared with you folks earlier. So we went over it again. We have a timeline regarding the expansion. We are currently accepting applications for DOE schools who are interested in opening up public pre-K classrooms. After that application period closes, we will spend time visiting the interested schools to get to know them better. And with this knowledge, we begin discussions with ELB on our budget requests, including how many classrooms we'll request for the following biennium. And with working simultaneous to the budget process, our team will prioritize those interested DOE schools in preparation for the next legislative session. We will work with legislators and hope the economic climate is right for a request for classroom. And after the legislature has set its budget, we hope to notify schools as to how many and which classrooms will be set to open in the subsequent year of the biennium. As is customary in our public pre-K program, we'll start the first year of the biennium with an induction program. New classrooms would open up in 24-25. Expansion involves the working with schools to prepare the opening of the classrooms, including school level positions and support positions within ELB to continue to implement the pre-K program as we scale up. We will definitely be looking at position increases as well. And this is just an estimated, it's just a cost. The slide just is really a reflection of if we were to open something like 20 to 23 classrooms, we're looking at a year one budget in the biennium of 4.18 billion, and then the sustained base budget cost annually of $3.5 million. This is not to say this is what we're requesting. We would need ELB, and we would need to work through that. The figure here is really just to provide some kind of perspective on the cost of the expansion. We just chose that amount of classrooms as a way to look at that. So the other pieces that we're looking at too is the family-child interaction programs, which are also within EOL's immediate area of influence, and we are working on establishing and eventually expanding the publicly funded family-child interaction learning programs, or FCILs. We have posted the RFPs, request for proposals for programs that will be held on 2 campuses in the coming year, and that's in Nanakuli and Kailua Elementary Schools. As you remember, we previously had FCILs at Keolu and Kaliuka Elementary Schools a while ago before the biennium. I'm sorry, before COVID-19 shut us down. The FCIL programs were put on pause because of the pandemic, as well as because of the corresponding budget restrictions. We were thankful to the legislature for enabling EOEL to once again establish FCILs, and we are excited to move forward with this vital component of expanding early care and education for all children for kindergarten. So shifting now to another arena of the work for the Act 46 efforts moving forward. And this arena of work it concerns the data work group. We know that we're going to need a data system among state agencies in the long term, not only for the success of Act 46, but also for the benefit of all the work we've done to that end, EOEL will be convening. We will take on our convener capacity role and stakeholders around the work that needs to be done. We are very grateful that Hawaii P20 has graciously agreed to assist in the facilitation of this work group. The data work group will comprise of about 12 to 15 individuals and include key personnel from state agencies named in the acts, which includes DHS, DOE, ELB, EOL, Charter School Commission, and Hawaii P20. The functions of this data work group will include looking at the, we'll be including establishing and executing the data governance program, in which data becomes more standardized, collected, securely stored, analyzed, shared, and used while ensuring the protection of individual privacy and confidentiality. It's also going to be looking at developing memorandum of understandings and data sharing agreements among agencies. In addition to that, identifying and monitoring the communication process to report the progress of meeting the goals related to Acts 46 and 210, and supporting and the collaboration and coordination among state agencies, public and private early care education providers, and the community members, such as the Early Childhood Data Collaborative. So we will provide more updates as the work progresses over the next. I'll just turn this one over to Dana.
Yeah, and then for DHS, we've extended the $5 million to modify existing IT systems for data collection and reporting. The IT transformation would expand the early learning capacity and availability of public pre-K. And expand and sustain affordable access and quality to early childcare for employees, families. We just look forward to furthering the intent of Act 46 and Act 210. And then we are also strategically meeting with stakeholders to determine best ways to increase child receipts through two new federal appropriations, the CURSA and the supplemental block grant, which can be expended up to September 2024.
So the next arena of work that's underway or has been underway has been the partnerships focused on improving workforce and program supports in the early childhood care education realm. We're looking at really the interdependency within the area of educational pedagogy, as well as supports for the workforce and programs. So these are some of the things that we're going on. The Professional Learning Institute with the University of Hawaii, that is an ongoing project. The state early literacy plan framework that we shared about a few years ago. The partnership with UH's ECE project and the HCYC, which I'll talk a little bit more about in the next couple of slides, and the educator stipend program. So as far as workforce and program support partnership, EOEL's partnership with UH and professional development and workforce initiative stems back to 2014 and has been further solidified to a memorandum of understanding between EOEL and UH College. For the past several months now, EOEL and DHS staff have been meeting with UH's early childhood educator excellence and equity project, as well as Hawaii Careers for Young Children. The work spans both private and public sector of both the public and private sector of early care and education, which is why it's so integral to be working alongside these three entities in particular. And more specifically, our joint work looks at the development of the ECE profession, the continuous quality improvement, career pathways, as well as professional compensation, which includes wages. EOL is moving forward with the early childhood educator stipend program as well, established in the Act 10. We are grateful for the $100,000 that the Samuel and Mary Castle Foundation has given to this program. We are currently working through the MOA with the Attorney General's office and the program is set to launch in the next academic year. And we look forward to working with ELB, the governor and the legislature to continue increased state investment for the next biennium. So that last arena of work includes the community engagement, much of what you shared with you the last meeting, I believe. As we set off in our planning, we are grounded in this purpose. We're looking at ensuring regular, meaningful community input and engagement to ensure long-term success of Act 46. We're intentionally wanting to have conversations to be framed by Act 46 by having conversations with the community. And we want part of this to be an opportunity to truly help the community lead the conversations around Act 46. EOL looked to fulfill our convener role in concert with DHS to gather our community sharing this so that we can act. The framework allows for us to engage in the community while empowering the community to drive the conversations and activities as we progress. And we've developed essentially 4 stages: planning, which we are currently in. We started shortly the small group convenings, moving to large group convenings, and the finalization of any actions or content that come out of the convenings. So we are aware that there's a long way to go regarding Act 46 and Act 210. We recognize our state and sector have faced a tremendous amount of upheaval with the pandemic over the past 2 years since the legislature passed Act 46 in 2020. We also have recognized that even when economic and political outlooks were not as favorable, there was still and continues to be that move toward a vision that is set by the state legislature. And we will continue to sustain and improve on the current infrastructure and programs and supports building off strengths and sustainable components, identifying challenges and potential barriers, as well as identifying pathways in order to develop multiple plans that provide children and families access to early education. That concludes our presentation. Thank you for your time. This was quite a long set of slides.
Thank you for sharing the work that you've done and laying the foundation to address some of the key pieces of the legislation. And also, Dana, I appreciate the inclusion of information about the challenges that COVID provided in your attempts to be able to even pursue the vision of Act 46. I think we appreciate that. Are there any questions or comments from board members? Either Dana or Khalid? Anything in the chat, Dana? Is there any? Hopefully that will give you some sense of where things are at the moment, what the plans are within the two agencies moving forward. And it seems a good segue at this point to introduce to all of you Lane Tsuchiyama, who was recently hired by the Early Learning Board as its institutional analyst. Wayne in that position will serve as the coordinator of Act 46, Act 210, and report to the Early Learning Board, as you recall. His first official day in the ELBL office was on this past Monday. And the panel who's recommended Wayne for this position was particularly impressed with his understanding of state agencies and the legislative process, along with his strong strategic planning skills, his familiarity with Act 46, commitment to a collaborative style, and his eagerness to learn. And I think that's a combination of characteristics added to his professional background certainly convinced us that he would be the perfect person for this new position that we are launching. I've asked Wayne if he would introduce himself a bit and share some things about his background that he feels would be appropriate to share with all of us, perhaps to address what attracted him to applying for this position, and a little bit about how he's gaining a foothold on the early learning landscape. So remember, he hasn't been working, well, yes, today is your first official week of employment, correct?
Yes.
Yes. One whole week on the job. Elaine, welcome. We're happy to have you. I'll turn the floor over to you for a few comments.
Thank you. Well, my name, like was mentioned, I'm Lane Tsuchiyama. I hope everybody can hear me. Previous to this, I served as a staff attorney at the Division of Consumer Advocacy for the Department of Commerce and Consumer Affairs. That agency represents consumer interests before the Public Utilities Commission. However, before that, I was the Deputy Attorney General in the Education Division. So I handle matters for the Department of Education, Board of Education. I was the deputy primarily in charge of the charter school, at that time, administrative office. I believe it's just the charter school commission now. And then at that time, the division also, education division also handles some University of Hawaii matters and also the judiciary. So I took the judiciary primarily. But I graduated from the University of Oregon School of Law. So, and my undergraduate degree is from the University of Hawaii at Manoa, and I'm a graduate of Lelegoa High School. So the thing that attracted me to the Early Learning Board was I believe that I can add a lot of capability to the board because I've worked in government for all the three branches. So I've also served in the legislature after I graduated from college. So I guess in a way I can help the board with a lot of the, I guess the minutia of kind of planning and working backwards because I understand and have a experience with how the process works from the back end. So from the other side that a lot of people don't see, so how things work at the AG's office, for example, how letters or opinions from the AG's office comes up to the board. So it's not as if you ask a question of the AG's office and you'll get a answer right away. There's a whole long and lengthy process. So, you know, part of that is hopefully helping the board and the EOEL to manage expectations a little bit better. But other than that, I've been familiarizing myself with the landscape, and everybody here on the meeting knows it's a lot to take in, and there's a lot of elements that work with each other, and it's a push and a pull. So I'm kind of trying to get the handle on all of that. So to the extent that anybody can help me, you know, familiarize myself a little bit better, I look forward to talking with everybody and trying to get all the different perspectives so that I can understand, you know, what is maybe some of the challenging areas and maybe what are some of the areas that work well. And as the outsider coming in, maybe I can see things that certainly some of you that have been in the field for a long time take for granted, but as a newcomer, I might be able to ask some questions, and then I might hopefully be able to give you some different insight or perspectives that maybe might help jog your memory and say, oh, that works well or that doesn't work well. So if anybody wants to contact me, I guess my email is, yes, will be available on the website really soon, but I look forward to, if anybody has any questions or wants to talk to me, they can just send me an email and I'll get back to you.
Thank you, and we'll be sure to put your email address in minutes so that people can contact you directly. Wayne is going to count on us as a board to be supportive of his efforts, but also to help pave the way for connecting with organizations and individuals that will be helpful in his research and in his conversations and planning. I suspect as he becomes more familiar, he will too reach out to you to get your insights, get your thoughts about this implementation plan and the coordination efforts that he's going to do. We're delighted to have you with us, and we appreciate the fact that we have given you a lot to explore. I gather, and listening to you over the past couple of weeks as we've chatted, that investigating things is something you enjoy. Learning new things is also something you conquer with you. So hopefully we can be supportive of those efforts as you move forward. Welcome again from all of us, and I hope you all get a chance to meet Lane in person in the not too distant future. Right, there are other items of the leadership update that I want to share with you. One has to do with the Early Childhood Systems Workshops webinar. If you had a chance to look through the updates that were shared with you, in the section of OHI put together on the Early Childhood State Plan and the PDGB5 activities, she listed in there the effort that's being provided by PDGB5 and their technical assistance efforts for a series of webinars, workshop webinars, over the next 5 months, I believe it is. And the significance of this effort is that it really is an attempt to have states not only define clearly what their systems look like, but also to graphically represent them, to come up with a visualization that will help others to better understand them. This is one of the challenges I think we have as a board. We have different views of what a system looks like, what the composition of those systems are. And I would encourage any of you who have the time and the interest to consider signing up for some of these workshops, webinars that are upcoming. First, about on March 23rd. There will be another one on May 17th, another one in July, and another in September. And the ideal part of this is not only is there information being shared amongst different states, but there are opportunities for the state teams to be working together so that the opportunity to apply what's being learned immediately is offered along with actually homework in between the sessions, which we have to do. One of the encouraging things to me was listening to other leaders from states and looking at some of their efforts and recognizing that everybody is challenged with figuring out how to define their systems, what are the global pieces, and then what are the subsystems that fit within the larger system, and how do you clearly communicate that information to those people who need to know it, with the stakeholders, the policymakers, and the funders, all of whom are key constituent groups who have to be incorporated in the work that we're doing. I did have the opportunity to sit in on the first one. It was truly informative from the point of view of looking at the impact of the complexity of the system on equity, on policy decision making, and obviously around the funding issues. And having to think about that in terms of our own particular state and what are the pieces that contribute to the system. So I would urge any of you who have interest and have time to consider sitting in on some of these workshops to engage directly in the conversation. Colleen, I assume we will be bringing back to the board the conversations and the efforts we make for approval and also for input. Is that accurate?
Yes.
Okay. So if you're interested, you can contact Logie. You certainly can contact me and I can pass the information on to you if you feel it would be helpful and of interest to you. I think it's something we need to get clearer on. And listening to the legislators in hearings and the questions they're asking, I think we have an educational job to do around system building and the EOEL's responsibility as well, and that we should consider as a priority moving forward. And the other item I wanted to bring up was around the legislative process that's going on, and some specific things about the resolutions, but just to update everyone on the status of confirmation of board members as a starting place. There have been 2 hearings this week. We had 5 board members who were either newly being nominated to fill seats that will be vacated at the end of terms in the end of June. And we also have some renewed members who are joining us, who are continuing, excuse me, in the process. So let me update you so you know where the status of the board representation stands at the moment. Ben McKee, as the representative of the Head Start provider, has been confirmed for another term. Kerry Yarosevich, as the representative of the Early Intervention Coordinating Council, was in the hearing that was held yesterday. They delayed decision making and will do their decision making on April 25th, I believe. I don't anticipate there will be additional testimony at that point. Iolani, as a representative of Y and medium early learning providers, was also confirmed this week. We have 2 new members who will be joining us. One is the center-based provider. Lonnie Al's term ends in June. Megan McCorston of Seagull Schools, the CEO of Seagull School, has been confirmed for her position. For that position, Megan brings an interesting balance, having been the executive director of Polo, which is the charter school corporation for 3 charter schools for a number of years, and also now serving as the CEO of a center-based private sector early childhood organization. So she brings both the public and the private experience to her role as a board member. Marty, is there anything you want to add about that? I should have included.
No, I just thought the process of trying to find somebody to step in was a bit challenging, and I'd like to recommend that the board have a plan in the future. And then just to remind everybody that the family childcare representative position has been vacant for almost the whole time I've been on the board. I think an effort should be to recruit them. Megan and I had a very nice conversation about the process, and she is very excited to start. So I'm glad she'll be there.
And just to address your two other issues, the process is listed as something we do need to take a look at so we can make it easier. And the other position that's been open, we have been trying for 4 years to get somebody to sit in that position and been unsuccessful. So if anybody has anyone to recommend, please let us know. We also added one other new member was confirmed to join us in July. This is the parent representative seat that Sherilyn has occupied. My role has been selected. She has a broad educational experience in early childhood and family resources. She has worked at Rainbow Schools as an assistant director. She has also worked for Patch, and she currently is part of the family CUI. Sharon, you want to add anything about Mai since you know her? Or Mrs. May? I'm not even sure how it's pronounced.
No, not much to add to Lonnie's comments. Yes, I really believe we need a family child care representative. But I am really thankful that May could possibly speak on their behalf as she worked with family child care providers for many, many years. So very excited that she's going to join the board, and I'm sure you guys will all love her. Thank you.
And thank you to you and Bonnie for helping us to find these members to occupy these seats. We also have one additional piece of information, and that is that Justina can serve in a holdover position for 1 additional year as the philanthropy representative on the board. We're really excited to know that that's a possibility. And Justina, thank you for agreeing to continue to serve in that capacity. Those are the updates around board members and the development of our board capacity. The other items that we already talked about, one of the legislative resolutions, the other two resolutions we discussed at the last board meeting. I wanted to bring back around to let you know the type of testimony that has been provided. One having to do with the effort to re-examine the nature of the board. That has come through, and also to define a strategic plan. The board asked that testimony help to educate the legislature about the board organization, but also to support, to let the legislature know that this has been one of our priorities. It is an intention of the Early Learning Board to examine its organization and its membership, and therefore we supported the intent of that particular bill. Information was also provided about the fact that the state plan and the strategic implementation plan really serve as our strategic initiatives at this point in guiding our work. And that was an attempt to help the legislators understand that we are including as our strategic efforts the work on behalf of moving those two plans forward. The other resolution is the one requesting that the board prepare a report containing a roadmap, including proposed legislation for the implementation of Act 46. In the testimony that was provided there, it was comments that were offered. And again, some of this was to provide context and educate the legislature. There is information provided in the testimony about the new position that Lane is occupying and the particular responsibility around that position. There also was a request to the legislature to consider extending the due date for the report. The due date that is considered now would offer fewer than 6 months to provide the information that's being required, which seemed to me, and I made this as this request as the chair of the board, not on behalf of the board, but as the chair, as I look forward to the amount of work that is going to have to be done in order to provide the kind of report to truly reflect legislative needs, but also the kind of information that would indicate a roadmap for moving forward, required an amount of time that would allow us to convene the work groups, gather the data from the stakeholders, to investigate the needs of individual items, since we know that they're going to be different, and the corresponding capacity in each of those areas, as well as to collect the workforce and facilities capacity information that would allow us to really do the kind of planning that would help to move our efforts forward. That testimony has been submitted for today's hearing. I do not know, obviously, what the reaction will be in the legislature. But I wanted you to know that I did take the liberty to request an extension, thinking that it was a much more realistic way for us to gather the data and provide something that would be informative and useful. That's all the information I have at this point on the legislative resolution. Any questions or comments? Please share. Anything in the chat?
There was a question for Lane. Justina was asking if he's working in the EOL office or fully remote.
I'm sorry, I can't.
Justina was asking if Lane is working in the EOL office or if he is fully remote.
He is not working for the EOL office, but he has a space in the EOL office to work for the board. The board employee. Any other questions? Nope. Christina, did that answer what you wanted to know? Or did you have anything else? Okay. Then let's move on to the member updates. Any updates from members?
Matt has an update.
Hello, everyone. Hot off the press. Finally, thank you very much for your patience, everyone, especially our Head Start directors and staff, the Head Start office, HCAN, plus all our dentist folks and friends. This is the oral health of Hawaii's low-income Head Start children. That's the survey that we had done back in 2018. So we are about to send that out to the legislators, and it is available currently on the DOH website. So it's available on the homepage in the banner section. So look for that. That's what I got. Thank you.
Thank you, Matt.
And then we have Justina and then Ben.
Hi, everyone. I just have a short one, which is next week is actually the Kahavai Summit, which is a professional development summit for all birth to 5 providers. And I'm hoping that we'll see some of you guys as well as staff there. It's a low cost summit and registration is still open, but we're actually anticipating about 300 people or more to attend. It's virtual and all the topics relate to how we support children and families in trauma-informed approaches and in their infant and early childhood mental health. So if you want more information, I'll just pop the email or the URL into the chat box. Thanks.
Thank you, Justina.
Ben?
Okay, sorry, lost my video. Just wanted to update everyone as far as enrollment levels for Head Start across Hawaii. Right now, we're at about 75%. That's putting all the programs together for Early Head Start and Head Start. But we're about 75% enrolled at this time. So there are still vacancies in most of the programs. And that 75% is about the national average right now. When we look at Head Start across the nation, overall enrollment is at about 75%. So I know programs in Hawaii here are eagerly looking to recruit families to finish out this year as well as for the upcoming school year. So just want to let you all know.
Thank you, Ben. Any other member updates?
Erin has a question.
Hi, I wanted to check in on the last meeting. We had a vote to take a look at this. I'm trying to look for the formal name here, the Strategic Implementation Subcommittee. So I just wanted to see if there's any updates related to the Governance Committee having an opportunity to take a look at that, so that we can plan our work going forward at the Capacity and Resources Subcommittee.
Why, Ali, you want to jump in?
Why Ali had to leave earlier.
She what?
She left already.
Oh, all right, I will wrap it. The governance committee was not able to meet. In the meantime, we had a meeting scheduled that had to be postponed. So it is not ready to come back yet and discuss it, but I assume by the next meeting that we should be ready. Okay.
Thank you.
Sorry to hold you up, it's just was not possible to connect with them. Any other member updates? All right, hearing none. The floor is open for public comment once again. Anyone wishing from the public to offer any comments, this is the time to do it. Again, the 2-minute time limit. The subject matter must relate to the agenda. Again, nothing in the chat. Okay. We're at that point in the meeting to review the agenda outcomes and close out the meeting. And excuse me. The agenda outcomes I've captured from this meeting are the systems mapping group presented us with a draft of the mapping budget. And it is strictly a draft. They will be coming back after more work with the partner agencies to share with us the recommendations for both the budget expenses and the sources of funding for them. At this meeting, we made an announcement that the Director Search Committee has completed its work and a new director has been appointed. We also have introduced the institutional analyst who will become the Act 46 coordinator. We have an update on board member confirmation. And we also heard from DHS and EOEL with regard to the work that they have been doing since the passage of Act 46 and 210. The challenges that have been presented by COVID, but the groundwork that has been laid in some specific areas. Some had to do specifically with program expansion. Some had to do with interagency data and the work group. Some had to do with workforce and some have to do with plans for stakeholder engagement. Both organizations have indicated they are working together, particularly around the data pieces and aligning their efforts to move Act 46 forward. Those are the major outcomes for this particular meeting. So unless somebody has something additional to add. Carrie, who is our bringer of good words to the end of our meetings, is not with us today, I'm afraid. She had to be absent. So I will end the meeting by simply saying, wishing everyone be safe, healthy, and happy. Hoping that more of you may join us. It is really nice to be in person and see people, even if it means that we have to share hugs with masks on. Thank you, Christina, for your wonderful cookies and hospitality. As always, it adds to the content and the experience of the meeting. I hope you all have a wonderful weekend, and I look forward to seeing you a month from now. Aloha.